Let's get right into it. 1. First, post-nasal drainage due to aging sinuses. Not everyone talks about it, but for many people over the age of 60, the morning often begins with a bothersome feeling in the throat. Before you've had a chance to brush your teeth or sip warm water, your throat already feels tight, prompting you to clear it, cough something up, or swallow repeatedly, trying to get rid of a sensation that just won't go away. That sticky substance, mucus, not only causes discomfort, but also makes many people feel embarrassed, especially during early morning conversations. What's surprising is that most people don't realize the real cause is something very familiar: the quiet, natural aging of the sinus system. As the body ages, the sinuses change too. The moist, elastic lining inside the nasal cavity begins to dry out and thin. But the biggest change happens to the microscopic cilia, tiny hair-like structures that used to sweep out dust, bacteria, and mucus efficiently when we were younger. After age 60, these cilia slow down, no longer able to move mucus effectively. Instead of draining through the nose as it used to, the mucus now flows silently down the back of the throat. This condition is known as post-nasal drip. It's not an acute illness. There's no fever, no pounding headache, no runny nose. But it lingers. Some people silently put up with it for months or even years, starting every single morning with the unwelcome ritual of clearing the throat. When the mucus drips and builds up overnight, it creates an itchy or ticklish sensation in the throat, leading to a dry cough first thing in the morning. Many people mistakenly assume this is a normal old age cough or blame it on dryness or even lung issues. But often it's simply untreated sinus mucus making its way down the throat. This problem becomes even more frustrating when it interferes with how you feel at the start of the day. Whether you're preparing breakfast, welcoming your grandkids, or just reading the morning news, the constant need to clear your throat can be exhausting. And then there's the social discomfort, especially in quiet places like church, classes, or group meetings. That small throat clearing sound or light cough may seem harmless, but it can make you feel like you're disturbing others, even if it's unintentional. Over time, this creates a psychological barrier, causing some to avoid social situations altogether, feeling embarrassed by their own body. The good news is, you don't have to live with this forever. A few simple lifestyle changes can make a noticeable difference. For instance, elevating your head or pillow while sleeping can help prevent mucus from draining down the throat overnight. Drinking a glass of warm water in the morning, especially with a few drops of fresh lemon juice, can help thin the mucus and gently clear the throat. Also, it's best to avoid overusing over-the-counter nasal sprays, especially decongestants, as they can cause rebound effects, drying out and irritating the nasal lining, and actually prolonging the problem. Additionally, you can rinse your nose gently with a saline solution using a nasal rinse device or a spray bottle. This helps flush out dust, pollen, and trapped mucus from the sinuses, supporting your cilia's natural function. A small habit like this, done regularly, can restore the feeling of clarity in your nose and comfort throughout the day. Post-nasal drip is not a dangerous condition, but it quietly and continuously affects your quality of life. And most importantly, it's manageable. Once you understand what it is and respond in time, your body, even at 60, 70, or 80 years old, is constantly sending you signals, not to bother you, but to remind you how to care for it in the right way, at the right time. If you've ever woken up with an itchy throat and didn't know why, feel free to share this sentence in the comments below to inspire others toward better health. I choose to listen to my body, even through the smallest signals. Who knows? Your words might be exactly what someone else out there has been quietly searching for. 2. Silent acid reflux, a hidden cause behind morning mucus. Of course, not all morning mucus problems come from the nose or sinuses. There's another cause, more subtle, more silent, yet just as common, especially in people over 60. It's called silent acid reflux. Unlike typical heartburn with its burning chest pain and sour taste, silent reflux doesn't cause any noticeable stomach symptoms. No pain, no fire, not even a burp. But it still happens and leaves its mark the moment you wake up. As we age, the lower esophageal sphincter, a valve-like muscle that prevents stomach acid from flowing back up, gradually weakens. When you lie down to sleep, gravity no longer helps keep acid in the stomach the way it does when you're standing or sitting. And if you eat late at night or consume acid-triggering foods like tomatoes, citrus fruits, chocolate, or fried foods, the risk of reflux becomes even higher. The problem is you don't feel it while it's happening, but the next morning you wake up with an itchy or sore throat, a hoarse voice, and a dry cough, or feel the need to clear your throat constantly. Many people mistake this for allergies or a respiratory condition, but in truth, the culprit is in the stomach, quietly working overnight. Here's something important. Your body doesn't just sit back when acid reaches the throat. To protect the delicate lining of your esophagus and vocal cords, it produces extra mucus, like a biological armor. And that mucus is exactly what you feel every morning. Thick, sticky, hard to swallow, and only goes away after coughing or spitting it out. This is your body's natural healing response. But if reflux happens frequently, this protective mucus keeps building up, making mornings increasingly uncomfortable and full of throat clearing. Many people have lived through this without knowing. One 68-year-old woman believed she had chronic bronchitis because she had to cough up thick mucus every morning for over a year. She tried cough syrup, steam therapy, even changed her toothpaste thinking it was an allergy. But after a doctor suspected silent reflux, she started sleeping with her head elevated and stopped eating after 7 p.m. The result? Within 2 weeks, the symptoms nearly disappeared. This shows that acid reflux isn't always obvious, but its impact is real and noticeable if you pay close attention. A lot of people over 60 feel helpless when morning phlegm doesn't improve, even if they eat healthy, stay warm, and drink enough water. It feels like you're doing everything right, but nothing changes. That can be discouraging, making you want to give up and just accept it as a part of aging. But the truth is, when the root cause is in the stomach, no external solution will work unless you treat it from the inside. So what can we do? First, start with your evening habits. Stop eating at least 3 hours before bedtime and avoid foods that are acidic or greasy. Elevate the head of your bed or use a slightly higher pillow to let gravity keep acid in your stomach while you sleep. If you like, drink a cup of warm ginger tea after dinner. It aids digestion and has a mild anti-inflammatory effect. Most importantly, if you suspect silent reflux, be clear with your doctor. Don't just say, "I cough in the morning," or "I have phlegm all the time." Describe the symptoms accurately. That helps your doctor make a proper diagnosis, often without the need for invasive tests like endoscopy. It's also important to know silent reflux isn't necessarily a serious disease. In most cases, with the right lifestyle adjustments, your body can recover naturally. But because it's painless and quiet, unlike heartburn, many people ignore it, delaying treatment. That's why mucus returns morning after morning, even if your nights feel normal. And one more thing, you are not alone in this journey. Thousands of people over 60 are silently dealing with the same symptoms. The difference is, those who recognize it early can make changes early and feel better, faster. If you see yourself in this story, leave a comment with the sentence, "I choose to care for my stomach to soothe my throat each morning." It could be the beginning of a positive change, not just for you, but for someone else who might need this gentle reminder today. 3. Dry indoor air. Even if you eat well, rest adequately, and have no serious medical issues, but still wake up every morning having to cough up thick, sticky phlegm, then the cause might be something surprisingly simple: the air quality inside your own home. Not street pollution, not heavy smog, but rather dry indoor air might be the silent culprit triggering your body to produce more mucus. It may sound counterintuitive. People often assume that humid air causes more mucus, but science shows the opposite. When the air is too dry, especially in enclosed spaces, your body tries to protect the delicate linings of your nose, throat, and lungs by producing more mucus to keep them moist. This is a natural defense mechanism, not a flaw. The mucous membranes in your nose and throat are sensitive. When exposed to dry air from heating systems in the winter or cold air conditioning in the summer, they react as if they've suffered a mild internal burn. And to heal and soothe that irritation, your body creates a fresh layer of mucus, a biological shield we recognize as phlegm. What's notable is that this doesn't just happen to people with underlying health issues. Even healthy individuals may wake up with excess mucus simply because the air around them is too dry, and they don't realize it. Common factors that dry out indoor air include heaters, air conditioning units, hot fans, central heating systems, or even just keeping windows closed all day with no airflow. In such conditions, your respiratory lining works overtime, producing more mucus than usual to stay hydrated and protected from irritation. Another lesser-known factor that contributes to dryness and mucus production is medication. Many older adults take medications such as antihistamines, blood pressure pills, diuretics, antidepressants, or drugs for Parkinson's disease, all of which can have a side effect of drying out the mucous membranes. And when those linings are dry, the body again compensates by producing more phlegm. So what's the result? You might go to bed feeling perfectly fine, but wake up with a heavy throat, slight shortness of breath, and thick mucus that's hard to clear. Some people need to cough or spit several times before they feel relief, and this cycle repeats day after day. Physically, it's unpleasant, but emotionally, it can also take a toll. Feeling embarrassed or self-conscious when you start coughing or clearing your throat right after speaking, especially during breakfast, while entertaining guests, or even just sipping tea and listening to the radio. Moreover, if this condition persists, the thick mucus can become a breeding ground for dust, bacteria, or mold, increasing the risk of respiratory infections in older adults. Those with weakened immune systems or chronic lung conditions are especially vulnerable to these complications. So what are some safe, natural, and effective solutions? First, take a good look at your living space. If you use air conditioning or heaters regularly, consider placing a small bowl of water near the air vent or heat source to help maintain moisture in the air. If you can, investing in a compact humidifier for your bedroom or living room can be a wise decision. Additionally, drinking a warm glass of water before bed and after waking up can help hydrate your throat lining from the inside, making it easier to clear phlegm. Some people also find it helpful to add a slice of ginger or a few drops of lemon to the warm water to gently enhance its cleansing effect. If you're taking medication, talk to your doctor or pharmacist to see if it might be contributing to dryness and whether there are alternative options or adjustments you can make to minimize this side effect. Don't stop any medication on your own, but knowing the cause helps you work better with healthcare professionals to find the right solution. The air around you may be invisible, but its effect on your respiratory health is very real. Sometimes you don't need medication or expensive treatment. Just a touch more humidity and a well-timed glass of warm water might be all your body needs to stop producing excess phlegm. These small changes can restore your morning comfort and help you breathe with ease again. If you've ever noticed that you cough up more phlegm on days when the heater or air conditioner has been running for a long time, feel free to share your experience in the comments with the sentence, "I'm adjusting my indoor air to soften my voice each morning." Just one simple line like that could be the gentle reminder someone else has been looking for. Fourth, medications that dry the airways or trigger excess mucus. If you've already adjusted your lifestyle, improved your home air quality, eat well, and have no clear respiratory illness, yet phlegm still builds up every morning, it might be time to look deeper into one commonly overlooked factor: the medications you take every day. For older adults, it's very common to use prescription drugs for managing high blood pressure, heart conditions, neurological disorders, allergies, or diabetes. But what many don't realize is that some of these very medications, though essential to your health, can inadvertently dry out your mucous membranes or trigger the body to produce more mucus as a side effect. Some medication groups are known to have this effect more clearly than others. These include beta blockers, used for high blood pressure and heart disease, diuretics, which reduce fluid retention but also dehydrate the entire body, including the mouth and throat, anticholinergic drugs, used for Parkinson's disease or overactive bladder, and even statins, used to lower cholesterol. Each works differently, but they all share a common impact. They interfere with the body's natural moisture balance in the mucous membranes, the first line of defense in your respiratory system. When these areas become dry, the body reacts by producing extra mucus for protection, and that's where the phlegm you clear every morning comes from. This often happens quietly. You start a new medication and feel fine for a few days, but gradually you notice you're clearing sticky mucus from your throat every morning. It's not painful, not alarming, but it's not comfortable either. And it lingers for weeks or even months. Because there's no fever, no chronic cough, no chest pain, it's easy to ignore or blame it on the weather. In reality, your body is trying to adapt to a new internal change, and you may not even be aware that it's happening. It's important to note that dry mouth or dry throat from medications doesn't just cause mucus. It can also lead to other issues like difficulty swallowing, mild throat irritation, temporary loss of taste, or even an increased risk of oral infections due to lack of saliva. For older adults, these aren't just minor annoyances. They directly affect daily quality of life. So how can you manage this safely and effectively? First and foremost, never stop or adjust your medication on your own, even if you suspect it's causing phlegm. Instead, keep a detailed note of your symptoms and discuss them openly with your doctor or pharmacist. In many cases, your doctor may switch you to a medication with fewer side effects or change the timing of your doses to minimize nighttime impact on the mucous membranes. There are also simple, natural strategies you can begin right at home. First, make sure to stay well hydrated throughout the day, especially in the late afternoon and evening, since nighttime is when mucous membranes tend to dry out the most. Second, try using sugar-free lozenges, especially those designed for dry mouth, to stimulate saliva production, keeping your throat and mouth moist. Additionally, avoid caffeine and alcohol before bedtime, as both can increase dehydration. A small but powerful habit is sipping warm water slowly throughout the evening, rather than drinking a large amount all at once. This helps maintain steady hydration of the mucous membranes and prevents that excessive phlegm response in the morning. If you're taking diuretics, ask your doctor whether you can take them earlier in the day. Taking them too close to bedtime might lead to frequent urination at night, disrupting your sleep and further drying out your throat. Don't underestimate the emotional impact of this situation either. When you feel like you're doing everything right, but your body still reacts with discomfort, waking up with phlegm, mild coughing, it can leave you confused and frustrated. Some people even fear it's a sign of a serious condition like lung disease. But sometimes all it takes is a second look at your prescription and a candid conversation with your doctor to clear things up. And that sense of relief, of clarity, that's often the first step toward regaining trust in your own body. If you're on long-term medication and have noticed more frequent mucus in the mornings, don't hesitate to dig a little deeper. Your body is speaking up, not to complain, but to ask for more thoughtful care. And when you learn to listen, discomfort becomes guidance, and each day becomes a little healthier, a little lighter. If you've ever suspected that a medication might be causing your excess phlegm, share your experience by commenting, "I choose to understand side effects so I can live more comfortably." A single sentence like that might be exactly the insight someone else is quietly searching for. 5. Prolonged exposure to fine dust and indoor air pollution. Even if you've already optimized your medication routine, maintained proper humidity levels, and followed healthy lifestyle habits, there's still one quiet, often invisible factor that could be affecting your respiratory system every single day: the quality of the air inside your own home. Unlike dry air caused by heating or air conditioning, which we discussed earlier, this time the issue lies in fine dust particles and airborne pollutants that aren't visible to the eye but make their way into every breath you take. According to the U.S. Environmental Protection Agency, EPA, indoor air can be 2 to 5 times more polluted than outdoor air, especially in enclosed, poorly ventilated spaces. And this becomes even more concerning for adults over 60, because as we age, the mucous membranes in our airways become more sensitive, reacting strongly to small irritants that may have gone unnoticed in younger years. Elements like PM 2.5, fine particles, NO2 gas from gas stoves, cigarette smoke, fragranced candles, air fresheners, floor cleaners, and even dust from carpets, sofas, or curtains that aren't regularly cleaned can all cause mild irritation to the airways. And how does the body respond? By producing more mucus to trap and flush out these irritants. The result? Persistent morning phlegm with no obvious explanation. One critical point: if you live near a busy street or in a large city where air quality alerts are common, fine particles can still infiltrate your home through window gaps, air conditioning systems, or even on your clothing and hair after you come back from outside. Without proper control measures, these microscopic pollutants can settle on every surface and remain suspended in the air you breathe daily. This issue often goes unnoticed. On an ordinary day, you stay indoors, maybe with a fan or air conditioner running, and you clean the house weekly. But every morning you still wake up with a clogged throat and have to clear your voice or cough mildly. You might assume it's a mild cold or a reaction to the weather, but in reality, your body is responding to your living environment, and these reactions build up gradually, day after day. The good news is you don't need to renovate your entire home to fix this. Start by opening your windows for at least 15 to 30 minutes a day to create air circulation, allowing polluted air to exit and fresh air to enter. If you live on a lower floor or near a busy road, try to ventilate in the early morning when traffic and pollution levels are lower. If possible, consider using an air purifier, especially in the bedroom, where you spend more than a third of your day. Next, try to reduce the use of synthetic fragrance products such as air sprays, scented candles, essential oil burners, or strong deodorizers. These often release volatile organic compounds, VOCs, that can irritate the nose, throat, and lungs. Choose fragrance-free, chemical-free, or natural certified products instead. Also, if you cook with gas, make sure to use a range hood or open a window while cooking, as nitrogen dioxide, NO2, released during cooking, can linger in the air for hours afterward. Another important tip: clean your home's soft furnishings regularly. Curtains, carpets, throw pillows, and rugs trap large amounts of fine dust. Yet they're often overlooked. For older adults, a clean living space doesn't just feel better. It helps reduce the burden on the body to produce excess mucus as a defense against invisible threats. The emotional impact should not be ignored either. Many older adults live alone or in quiet spaces, where every sound is more noticeable. A throat clear, a dry cough, or the need to spit up mucus in the morning. It can feel uncomfortable, socially awkward, or even lead to excessive worry about having a serious illness. But once you understand the root cause and begin taking simple steps to improve your indoor environment, you'll start to feel more in control, more confident, and phlegm, like an unwelcome guest, will slowly stop showing up. If you've ever suspected that your home's air quality is affecting your throat or voice, feel free to leave a comment with this short but empowering sentence. I'm purifying the air around me every day. Even a small action or a positive thought like this can lead to a major shift for you and for others on the same journey. 6. Age-related pulmonary decline. Even after ruling out external factors like medication, indoor air pollution, or dry household air, there's still one often overlooked but deeply important reason why many older adults wake up every morning with mucus: the natural age-related decline in lung function. It's not caused by illness or infection, but by aging itself. It happens to all of us, yet is rarely acknowledged or addressed properly. Over time, the structure of the lungs, one of the body's most flexible and sensitive organs, begins to change. The elastic tissues in the lungs lose their stretch, making inhaling and exhaling feel less smooth than before. In addition, the tiny cilia in the bronchial tubes, responsible for sweeping out dust and mucus, start to slow down and become less efficient. As a result, mucus builds up in the respiratory tract overnight, and you begin to notice it each morning, having to clear your throat or cough up phlegm that seems to appear out of nowhere after a restful night's sleep. This usually happens without the classic warning signs: no fever, no persistent cough, no sudden shortness of breath. You feel normal throughout the day, no cold, no bronchitis, but each morning you may need to cough, clear your throat several times, or feel a lingering tightness in your chest. For many, this becomes so normal that they stop noticing, until it begins to interfere with daily life, especially when communication is needed early in the day. What makes this situation especially tricky is that it doesn't show up in routine medical tests. Chest X-rays, lung function tests, and blood work often return normal results. But that doesn't mean your lungs are performing like they did at 30. Reduced elasticity, weakened natural clearing mechanisms, and less forceful cilia movement are subtle, cumulative changes, but their effect on your breathing quality becomes increasingly noticeable over time. The good news is, While this is a natural part of aging, you can slow the process down and significantly reduce morning mucus if you support your lungs the right way at the right time. Start with controlled deep breathing exercises. Just a few minutes a day of slow, deep nasal inhalation, holding the breath for a few seconds, and slow mouth exhalation can help expand your lungs, improve oxygen exchange, and stimulate the cilia to function better. If you add gentle practices like breathing-focused yoga, qigong, or meditation, the benefits can go even deeper. These are not just physical exercises. They help relax your nervous system and restore your overall breathing rhythm. Next, don't underestimate the power of daily movement. Even if it's just 10-15 minutes of walking around the house, stretching your arms, or doing light seated exercises. When you move, the diaphragm and intercostal muscles, which support your breathing, are activated. This helps your lungs expand more fully and assist in pushing mucus out of small airways, reducing phlegm accumulation overnight. Studies have shown that older adults who maintain a regular walking routine have significantly better respiratory function and experience less morning phlegm than those who are mostly sedentary. Also, remember to stay well hydrated throughout the day. This helps thin out mucus in the lungs, making it easier to clear. Even mild dehydration can cause mucus to become thick and sticky, much harder to expel. The emotional side of this issue shouldn't be overlooked. Waking up each day coughing or clearing mucus can be frustrating and even worrying. Some people fear it's a sign of something serious. Others start avoiding morning social activities like family breakfasts or community gatherings, simply because they don't want to make noise or feel self-conscious. But it's important to remember, this is not something to be ashamed of. It's simply your body asking for more attention and care, and you can respond with small but powerful actions. If you've ever thought that morning phlegm was just part of getting older, it may be time to reconsider and respond differently. Just 5 minutes of intentional breathing in the morning, 10 minutes of light walking each day, and a commitment to keeping your body hydrated could lead you to wake up with a clearer throat, easier breathing, and a more positive, energized start to your day. If you're already taking small steps to support your lung health, share your journey by leaving a comment. I'm actively helping my lungs get stronger every day. Sometimes a simple action can be the spark that inspires something much greater in your life and in the life of someone who just needed a reason to begin again. 7. Consuming dairy products at night. After examining all the usual suspects, age-related changes, lung function, medications, and air quality, there's still one lesser-known factor that can significantly contribute to morning phlegm. Consuming milk or dairy products at night, especially just before bedtime. For many older adults, drinking a warm glass of milk before bed feels comforting. It helps soothe the nerves and creates a cozy sensation in the stomach. But what most people don't realize is that our bodies, especially after age 60, may react to dairy very differently than they used to. Cow's milk contains a protein called casein, and some individuals, especially those with sensitive digestive systems or mild lactose intolerance, may not process it well. The reaction isn't a dramatic allergy like a rash or shortness of breath, but rather a mild, persistent irritation in the respiratory lining. When you drink milk, particularly in the evening, your body may respond by producing extra mucus as a protective measure, coating the throat and esophagus to defend against what it perceives as a foreign protein. This mucus, if not cleared before sleep, quietly accumulates throughout the night, and by morning, what you feel is that sticky phlegm in your throat, requiring a few coughs or throat clears before you feel better. Many people assume this is due to sleeping in cold air or dry air at night, but in truth, the timing and type of foods consumed in the evening can play a big role. If you have the habit of drinking milk, eating cheese, ice cream, or yogurt before bed, it's highly likely you're unknowingly contributing to mucus buildup in your airway. What's important to note is that even if you don't feel sensitive to dairy during the day, your body might still react at a low level, especially when combined with the lying down position and slower breathing during sleep. That's why some people feel fine all day, yet wake up each morning with a throat full of phlegm, and they would never suspect that their soothing glass of milk could be the cause. So how can you tell if dairy is contributing to your morning mucus? The simplest method is to stop consuming dairy products in the evening for 7 to 10 days. There's no need to eliminate it completely, just change the timing. If your morning phlegm noticeably decreases, that's a clear sign your body may not tolerate dairy as well as you thought. Worried that cutting out milk will disrupt your sleep? Don't be. There are many gentle, natural alternatives that support relaxation without triggering mucus production. Options like almond milk, oat milk, or a warm cup of herbal, caffeine-free tea such as chamomile or peppermint can help you unwind without irritating your respiratory system. Even a glass of warm water with a spoonful of honey can soothe the throat and promote restful sleep without the sticky side effects in the morning. In addition to changing your beverage, pay attention to your sleeping posture. Elevating the head of your bed slightly or using a higher pillow can help prevent mucus from collecting in the throat while you sleep horizontally for 6 to 8 hours. This becomes especially helpful when combined with evening dietary adjustments, giving your body the ideal environment to rest and recover naturally through the night. The emotional impact of this seemingly harmless habit is also worth reflecting on. Many people, due to that sticky, uncomfortable sensation or a mild dry cough in the morning, lose their motivation to start the day feeling fresh. Though not a serious illness, the constant discomfort can quietly chip away at quality of life, making you feel like your body is malfunctioning in ways that are hard to explain. And without knowing the cause, it's easy to blame aging and simply resign yourself to it. But remember, aging doesn't mean you have to live with daily discomfort. Small changes, from choosing the right drink, adjusting your dinner time, to modifying your sleep posture, can make all the difference. These simple steps may help you wake up feeling lighter, without that stubborn phlegm in your throat or the need to cough before saying your first word of the day. If you've had the habit of drinking milk before bed and are now considering switching things up to feel better in the morning, share your positive shift in the comments with this message. I'm choosing better nighttime drinks so my mornings feel lighter. Your gentle reflection might be the exact suggestion someone else is quietly searching for to solve their own mystery. You may have gone your whole life without realizing that a little phlegm each morning is actually your body's way of speaking to you, clearly, quietly, and consistently. It's not random. It's how your body responds to your environment, to the food you eat, to the air you breathe, and even to the way you live each day. The beautiful truth is, once you understand that, you can make a change. Not with expensive medications, not by fearing the worst, but through small, natural, and surprisingly simple steps. We hope that after watching this video, you now have a clear roadmap to navigate those uncomfortable morning phlegm moments. Whether it's recognizing deeper causes like acid reflux, age-related lung changes, or even that glass of milk before bedtime, or taking small actions you can start tonight, like elevating your pillow, practicing mindful breathing, or simply opening your window to take in a full, fresh breath of air. It's from these little changes that life begins to feel different. Lighter breaths, smoother mornings, a brighter, more peaceful mind. If today's video brought you something helpful, leave us a comment below, something simple like, "I understand my body better after this video." Just one line can be a spark, not only for you, but for others who are quietly listening and going through the same thing. And if you feel our work is worth supporting, consider using the Super Thanks feature. It's the small thank you button right below this video, and every click is a huge encouragement that helps us keep creating warm, thoughtful, and valuable content for the older adult community. Don't forget to explore more of our videos now appearing on screen, or choose a topic you care about from the suggestions on the side. We're always updating them with the most practical insights to help you live healthier, live more deeply, and live in tune with your body. We'll see you in the next video where we'll continue this journey of truly understanding, loving, and taking care of ourselves the right way. Care better. Live stronger every day.